Cases of syncytial, also known as RSV, have been on the rise, and while it typically does have more severe impacts and effects on newborn children, cases of the virus are having a great impact on adults aged 60 and older. Dr. Alan Kaplan is a family physician and joins us now. Good morning, doctor.
Good morning. How are you this morning?
Very good. Thank you so much for asking. Give us a feel. What is RSV and who's most at risk?
Well, this is a very common contagious respiratory virus that causes lung issues, breathing, cough, shortness of breath, and wheeze, which is the difference from most viral infections. And it's most at risk for the very young and people over the age of 60, especially people who have problems with lung function already, chronic conditions like diabetes, heart disease, heart failure, kidney disease, and if you have an immunocompromising condition where immune system.
Sure. That's significant for those older. And how does it spread? I mean, is it like other viruses?
Pretty well, just like cough and sneeze, and even touching infected surfaces can do that. Interestingly, though, it can persist. Someone can persist in carrying it for quite a long time. It can stay as long as 3 weeks to be contagious if your immune system is a little bit weaker.
Okay, interesting. What are the signs and symptoms of the virus, and kind of how does it compare to the common cold, the flu, or even COVID-19?
Well, unfortunately, it's a little hard to tell them apart for the most part, with headache, runny nose, sore throat, being fatigued, congestion. But the cough is more significant, and the fact it can cause wheezing is a little bit different. The problem is it can lead to very serious effects in the older adults, with complications like pneumonia, hospitalization, even death. And it also causes reinfection because it doesn't cause a persistent immunity. Once you get it, you're not immune for life.
Oh.
It may last a season, but the next season you're up to maybe getting it again.
So you mentioned seasons. When is RSV at its peak for infection? When are most people likely to get it?
Well, typically from October till May, but the highest times are going to be from December to March.
Okay, so kind of on par with some of the other waves of viruses coming through. That's good to know. How is it typically diagnosed then, if it does have similarities to others?
Well, unfortunately, it's not routinely tested for, but the testing is much like we've all got used to with the PCR test, the swab that goes into the back of the nose.
Right.
That's how we do that. But it generally doesn't get done in the general community, usually mostly in the hospital setting for it. So we don't have really as great data for how much RSV is there, but the estimates are almost 500,000 hospitalizations in the high-income countries. So that's really where we have to really be worried about, and up to 30 some odd thousand deaths. So it can cause hospitalization, which is actually less common than it is in young children. But the concern for older adults is the fact that it has a significant risk of causing a severe hospitalization and death in older adults. That's why we have to be concerned.
Wow, yeah, absolutely. And how does the natural decline, because you talked a bit about this, and the immunity increase someone's risk of getting sick with RSV?
Well, unfortunately, you can't fight it off as well. So therefore, that leads to these big clumps of mucus and cells, what are called syncytium, which is why it's called RSV. And they can lead to blocking of the airway in the small airways and the large airways. In addition, the inflammatory release that occurs with a viral infection can cause like heart attacks within a couple of months afterwards. And then lastly, you end up getting, it can really be an issue in terms of recovery, and it can take a long time to recover. And with that, up to 8% of people actually lose their independence. So for people over the age of 60 who are on the cusp of having issues, potentially because of their age, it may tip them into a dependence where they need help.
Yeah, and that's significant because we're talking about older individuals and the impact. Are there longer term impacts on the virus for older adults then, and how can they protect themselves?
Well, the risks, again, are going to be secondary complications like bacterial pneumonia and things like cardiac complications like heart attack and stroke. So that's why it's important to try to prevent. We can protect by doing all the things we've already learned in COVID: washing your hands, keep your hands off your face, avoiding close contact with sick people, covering up your coughs and your sneezes, cleaning it and disinfecting around you, wearing a mask, especially when you're sick, and staying home when you're not feeling well. But the exciting thing is that this fall, we're hoping to have the release of the first RSV vaccine that can prevent our population from getting RSV infection, and especially preventing the severe long-term.
Well, thank you so much for providing us all this information and good news there, too, on RSV. Dr. Alan Kaplan. And if you want to find out more about RSV, you can also go to Health Canada website at canada.ca and just use the search for RSV on there. Thank you so much. Have yourself a great day.